Why should we care about our skin?
First of all, when let's say I meet you the first time, the first thing I'm gonna look at your face.
Very
right?
true, very true.
Even though you go for a job interview, you know in Vietnam now, if a young boy like that with the scar face, he can't get an office job. Even a waiter, he can't get with the acne like this.
Wow, really?
You think I'm joking? You go Vietnam and see, working in restaurant, all their skin must be good.
The sun is damaging our skin, like especially in Malaysia. Is it one of the biggest killer?
I would say sun is one of the most important factor to cause our skin aging. There's actually one lady, those lorry driver, long journey one. Half of her face full of wrinkles and dry and sagging, and another face is okay because he only drive long time. There's the window one side is shining. Yes, if you live in tropical country, sunblock will be your first defense.
What are the factors that actually cause inflammation?
It can be from a diet, and it can be from the pollution like air, water, and those junk food and also processed food.
The best combination is, of course, face cleanser, then retinol, and then moisturizer.
Yes, because now we found that retinol is one group of medication that can help you on your skin regen, like you say, and also it's a part of anti-aging.
It's a expensive product, a skincare product, better than those you find on the normal shelf.
I would say
Welcome, Dr. Jin, to the show.
Thank you.
I want to ask you one question. We jump right straight into it. It's a very simple question, but I think a lot of us need to know, why should we care about our skin?
Okay, first of all, skin is our largest organ in our body. All right, it carries a lot of function. All right, let's put aside all this medical function. We talk about practically. So first of all, when let's say I meet you the first time, the first thing I'm gonna look at your face.
Very
right?
true, very true. Yeah.
I mean, this is the fact that nowadays, even though you go for a job interview, right? So the complexion of your skin will reveal some sort of like personality. Maybe if I'm in this field for quite some times, so let's say I look at you, now you have a good skin, I would think, oh, okay, this guy, maybe a very disciplined guy, right? Take good care of their skin, and so, well, maybe he's a very good guy because of have good skin. But this is just a very superficial type.
The first impression.
First
right?
impression, yeah. So therefore, I think skin, you really need to take care of it since the young until when you're old.
Yeah, that's a very good point, because a lot of us, especially entrepreneurs, I think this is something very important, not just for individual, but also like if someone who is into entrepreneurship, trying to go out and meet clients, meet investor or whoever. I think we always invest a lot in skills, invest in money, invest in our health even. But
Yeah.
skin, we always often overlook.
Yes.
Right, and especially living in Malaysia, with such a poor diet lifestyle, right? Food, the sun, the rain, the pollution. Are these some of the major causes that our skin is actually getting worse and worse?
Yes, because there's a lot of study, right, telling you that like pollution, lifestyle, bad habit will affect the skin health. Okay, so but if you dive deep into and want to know what exactly happened, basically they are talking about aging. When it comes to aging, there are two main things we are talking about is inflammation, and also the cell regeneration is slower. So all these kind of factors, like what you say, like lifestyle, diet, will indirectly and also directly affect the so-called the process of healing, and also the speed up the aging process. So therefore, if you ask me nowadays, is people aging faster compared to last time? I would say yes.
Oh,
Yeah, it will age faster now. But because of the technology and also the advancement in medicine, we have a lot of tools and also technology to slow down the aging because we know more. So therefore, I always say that we are using science to slow down the aging. It's not just by talking. For example, if you ask me some Chinese medicine, right, traditional medicine, you take ginseng, then will slow down the aging. I'm not sure, because you need to have a clinical proof that certain type of people taking this kind of traditional medicine, and it give you a benefit of slow down the aging.
I see.
So
sorry.
talking about inflammation, right? Just now you mentioned, what are the factors that actually cause inflammation?
A lot. So it can be from a diet, okay, and it can be from the pollution like air, water. I can tell you that the air that we are breathing now is not really that good.
Oh.
Yeah, compared to last time, especially you're living in the city. And also your body react to those chemical that you're using and those junk food and also processed food. We have a lot of different type of chemicals that trigger this inflammation occur inside your body, but this will not give you any symptom normally.
Oh.
Yeah, you can't realize one. Even
So
with
it's hidden actually.
It's a hidden. We call it a chronic inflammation.
Chronic.
Yeah, chronic inflammation means it's a long-term inflammation. So the symptom will come maybe after maybe 10 years, 15 years.
Oh wow.
So therefore, nowadays if you follow the trend, you have a lot of these gurus and come and tell you got biohacking and talking about longevity.
Yeah, like Brian Johnson and all, right?
Yes, all of them are trying to slow down the inflammation inside your body.
I see.
Yeah, even you go to gym, you build your muscle, there's also inflammation happening. So that inflammation also have some sort of this causing you to have more stress. We're talking about more stress as in when your body have inflammation, your stress hormone will eventually rank a little bit higher because you need to cope with the stress. So let's say you go to gym, you're building the muscle, you have inflammation, and if you take a blood and test for your stress hormone, sometimes it will be raised.
I see.
Yeah, and all these stress hormone will directly link to those hypertension, maybe heart attack. Yeah, so inflammation is just a general terms.
And all this will show up in your skin. How does it show up in your skin?
Okay, skin actually, I would say our skin is very durable. Okay, so no matter how harsh the environment, your skin will still can cope. So that's why I say skin is a very strong organ, and somehow it will heal. Let's say you have a cut, it will heal, right? Yeah. So if let's say happen so-called like inflammation, very bad inflammation, that one we're moving towards the skin disease like eczema, psoriasis. All these are due to unknown reason of inflame. You don't know what caused it. That's why it show up the symptoms. Yeah, but for me, I'm actually dealing a lot of these on the face, not the body. So sometimes if you have very severe case on the skin disease, normally I will refer you guys to those dermatologists in the hospital. Let them handle with the medical way. So instead of using like traditional medication, or some even go to pharmacy to get some cream that recommend by pharmacists. Yeah, most of the time it doesn't work.
Okay.
I see. And how about sun damage? Like we talked about, the sun is damaging our skin, like especially in Malaysia. Is it one of the biggest killer?
Yes, I would say sun is one of the most important or big factor to cause our skin aging. Especially our geographical, because we are living in tropical country. Most of the time we have sun. So if you base on some study, there's actually one picture, maybe you guys can go and Google. There's one lady who are those lorry driver, long journeyman, like the truck driver. Half of her face is full of wrinkles and dry and sagging, and another face is okay. Why?
Oh, okay.
Yeah, because he only drive long time. There's the window one side is shining. Yes, that picture are very very big difference in terms of between left and right.
Wow.
In Malaysia.
That one is in the picture. That one is in overseas.
Oh, okay.
So this just to tell you that sun can actually give you that kind of damage without you doing any other thing. Just the sun.
I see.
Yeah.
I see.
Because UV can change your DNA, can damage your DNA, can produce a lot of free radical in the skin and also inflammation. Yeah. So therefore, if you live in tropical country, sunblock will be your first defense.
I see.
I would say your first defense. If the best one, if you can have a cap, long sleeve, that would be the even better.
I see.
Yeah.
So even male for us, we have to put sunblock lah, basically.
Yes, actually sunblock is for everyone.
I started putting sunblock every single day when
really?
I go out 1 year ago, because I heard about all these YouTubers lah, gurus lah, skin specialists lah, they all talk about sun is the biggest killer, you need to put sunblock. And I see my skin, because I play golf pretty often as well, and I go out to the sun, so I start to see my skin start to have a lot of pigmentation, like dark spots.
Yes.
So I start to believe maybe there's some truth to it, but I haven't got a chance to ask like a professional or a doctor, is it really that's the case, or is just publicity or all those,
Or just they want to make money.
they just want to make money out of buying sunblocks.
Last time when I'm not in this field, putting sunblock for me is just to get dark. That's my first intention,
Yeah,
right?
yeah, yeah.
I don't want to get darker.
And that's
I
the
don't-
people's perception of putting sunblock is to avoid
Exactly.
getting dark, but they
Yeah.
actually will get dark also.
yeah, I don't want to get dark. That is the first thing come to into mind when you put sunblock, right? But actually, the reason why we ask you guys to put sunblock is the UV will kill off your collagen, will kill off your elastin, and your skin will get dry. So all these negative impact will make the whole overall look of your face is like gonna be like older, 5-10 years older.
I see.
Yeah, because you loss of everything. Yeah, because when you talk about collagen, everybody want collagen. Who don't want collagen? Everyone want collagen, but the UV will break down all the good collagen, and therefore you're gonna look old. Yeah.
I
So sunblock is a very essential thing for me in terms of aging. You're talking about, if people ask me what's your first line of defense in terms of aging, I would say sunblock. Not supplement, not your lifestyle, not everything, but sunblock is the first. Especially living in Malaysia.
I see.
Yeah.
Wow. Okay, that's that clarifies a lot of things. I think we'll touch more about sunblock in the skincare part because I wanted to talk more about like skincare versus
products, right?
The products,
Yeah.
and also versus going. When is it time to go to visit an aesthetic doctor like you in your clinic to get treatment? So let's talk about skincare routine first.
Okay.
We talk about sunblock is essential. There's so many products in the market. Toners lah, serum lah. I also use a couple. I have my own skincare routine at night as well. And different people is giving different advice.
Yes.
Coming from you, what is the minimum, like the best thing that people can do at home for their own skincare routine?
Okay. For skincare routine, normally I will divide into two groups only. Two groups of people. One is dry skin, one is oily skin. Alright. I would say Malaysian 80% people are having oily skin, 20% is dry skin. Okay. So like you say, a lot of people have different opinion.
Yeah.
All right. Maybe when now I talk like my routine, somebody will come and tell me, no, you're wrong, doctor. Right?
Yes,
So
they recommend you 10 products that you need to use.
it's very normal. All right, because there's no right or wrong. All right, it's just that whether it works or not. Okay. So for me, the most basic one, I take myself as an example. Okay. In my toilet, I only have 4 things: cleanser, moisturizer, sunblock, and one more is the exfoliator.
Exfoliator.
Exfoliator means to take away your dead skins.
Oh,
Yeah,
okay.
that is by right, it should be used by everyone. Reason, everyone here sitting out here, we have a dead skin layer. Okay, oily skin type people have thicker dead skin layer. So this dead skin layer by right is supposed to come out. They will fall out itself, right? Because our skin growth is from the younger skin, and they slowly grow up until the dead skin, and then they fall off. So this process normally take 28 days to 36, 38 days. Something. Some people are 43. So when you're growing older, this time will be getting longer. So when longer means the accumulation of the thickness of the dead skin is thicker. So when the dead skin layer thicker, shows that there's no complexion, no radiance, not glowy, very dull kind of skin. So especially like oily skin type people, they're very thick. They need to focus a lot in take away the dead skin layer in terms of putting more moisturizer.
Right.
Yeah. There are a lot of wrong information circulating outside, which I really don't like. One is some people will say, oh, you're oily skin type, but your skin is dry. So they ask you to put more moisturizer to counter so that the skin won't produce more oil. This is normally circulating outside, right?
Yeah, that's what I heard. And that's what I started to practice.
Yeah.
Right.
So basically, it's not correct because oily skin type people sometimes do not require moisturizer.
Oh, really?
Yeah.
Okay.
So it's the same response I'm getting from most of my clients. They say, huh, really? You don't need me to use any moisturizer.
But I do have dry skin though, especially after I bathe.
You have,
Yeah.
because you don't have acne issue.
Right.
Yeah,
but
but
I
for-
have oily skin at the same time. But if I don't put moisturizer, I feel dry. I feel like bit like a bit stingy sometimes.
Yes,
Your face is oily, man. I don't really think your face is oily though.
I feel because I put a couple of stuff on, like, especially sunblock. Once I put sunblock, it feels a bit less oily.
No, but for myself, my case, right, if I put sunblock, right, actually I feel more oily actually.
I think it depends on the sunblock, right? Yeah, there's one certain brand sunblocks I put is more of the liquid type, the white color liquid type.
yeah, mine is also the white color. But for my face, right, it's definitely oily.
yeah, because you have acne, and you have acne
I
scars.
have acne problem.
So
Yeah.
you definitely have oily skin. So for sunblock, actually now the new trend is we have water-based sunblock. You should use the water-based.
Water base. Okay.
Water-based means they are less oily, so it's more suitable for oily skin type of people. Because if you use like the white
The
colour
gel
type,
one,
the
yeah.
gel one is better, of course.
Okay.
If you use a very creamy one, right, will create a lot of blockage on the skin.
Oh, really?
Oh.
Yeah, and that's where the acne start to form.
Oh, I see.
So they also use some oil, right? It's a form of oil also, right? Sunblock, is it?
Yeah, it depends on the SPF. The SPF, the higher, right, they will make it into like a bit more texture, a bit more oily type.
I see.
But to be honest, if you want something to absorb better on the skin, you need to be in a ointment form
Ornament form.
because your skin doesn't absorb water much.
Ointment form means like oil type lah. But
If you put oil and the water, the oil normally absorb much better. But there's a lot of people cannot use oil. Like Steve, you can't use oil.
Yeah.
Definitely, it's no for you. Regardless how good is the oil, yeah. So you can't use.
I see.
Yeah,
So what about coconut oil? Is that there's a thing, to
Yeah,
it's a
coconut oil.
good moisturizer for people who have dry skin.
I see.
Yeah.
Okay.
Actually, how to differentiate dry and oily skin is very easy. If you see someone there's no pores, right, they are dry skin.
Oh, yeah. I have a lot of pores, so my one is oily skin definitely.
Yeah, a little bit of oily in the T zone. Yeah. So some are even not. I would say like mix. Maybe you are the mixed type.
Yeah.
Means not too oily until you're going to have acne. But you're also not too dry until you have wrinkles and pigmentation.
I see.
Yeah. Actually, all this is fixed since first day you are born. You cannot achieve from oily skin. I want to do something to become like no pores. Actually, you can't.
Oh, really? Yeah. So for me personally, I always have pores. I know you can't see it because I'm disclosing here. I do put a bit of foundation for the podcast. Okay, so maybe it's lesser, not too prominent, but I do have like big pores on the nose and the cheeks. So those are already set in stone. There's nothing I can do to make it like Korean celebrities kind of skin.
I cannot like make it smaller from the technology itself.
Smaller can, but not disappear.
I see.
Yeah, a lot of people will come. Korean celebrity.
Yeah.
Right? They want to
oppa,
have the
become-
poreless, right?
Yeah.
I can 100% tell you they are all makeup.
I see.
I see.
Yeah. Or maybe they're born with it. There are people born with that kind of skin. I seen before.
Wow.
Right.
Yeah. They are like no pores at all.
Yeah.
It's like
yeah.
very
Fair,
smooth.
smooth.
Really
yeah.
envy when I see
And
that kind of
they
skin.
do not require any kind of special skincare routine. One. Their skin is like this.
So it's
Oh.
genetic.
Yes.
I see.
I thought I was like didn't take care of my skin. That's why I have like these pores, maybe from the sun, from not taking care of the skin properly.
Pores, it will become big, but we can minimize it, but we cannot make it disappear.
I
Because
see.
that is the normal structure of the individual skin. It's like this. They have pores. Because there's a place where the oil came out. You cannot make the holes disappear, right? Then
I
where's
see.
the oil go? It's impossible. Yeah, I can make it smaller, not so visible, but cannot disappear. That's a fact.
In terms of making it smaller, you mentioned, so that is something that we can do at home or has to visit the clinic like yours?
Okay. Pause. There's something very interesting. First of all, if you want to know that whether you have pores or you have scars, you must ask yourself whether this hole sometimes become big or sometimes become small. If it's this thing is will change throughout the day, it's a pause because pause will change. Right? You can go back now. You can go back home, try and see. Your pause will be the smallest in the morning. When you have a good sleep, no disturbed sleep, having no alcohol at night,
Right.
the next morning your skin will be super good. The pores will be the smallest. But when you reach evening time maybe after a workout or the whole day, then you see the sebum all start to produce, right? The pores will definitely become bigger. That is pause.
Yeah.
That is pause.
Yeah.
So the best result I can give you is the morning, until the morning. Yeah. Of course, we have a lot of things that we can do to minimize the pause. So first thing first, If you want the pore to be smaller, you need to stop the oil gland production.
Oil glands production.
Meaning
Sebum?
lesser oil, lesser sebum, meaning equal to smaller pores. This is my equation if you have less sebum. More sebum, pores will be bigger.
Okay.
Yeah. So at home, how to reduce sebum? Yeah. There are a few factors that's always say. Number one will be stress. Stress in terms of lack of sleep, playing phone at night, traveling, car accident, hospitalized for some big surgery or surgery. All this is terms of stress. Even ladies who have pregnant, giving birth also have stress. That's why some of them production sebum a lot. Then therefore they have acne. Second will be diet. Diet, there are three main things: dairy products, sugar, and also these what's it called? The commercial fried oil. The oil that used outside, like McDonald's.
They reuse the oil,
Yeah.
right?
Home cooked oil normally no issue. If you fried chicken at home, you eat no matter how much you eat, you will be okay. Why? Because commercial oil contain a lot of these DHEA. We call it a natural male hormone. That's why Chinese say after eating you feel heaty, heaty.
Yep.
That's because of the male hormone is increasing. So when male hormone androgen is increasing, your sebum production will be more. So sebum production more equal to bigger pores and more high risk of getting acne.
I see.
Yeah, this is the diet
The food.
Yeah, and third one will be skincare. The wrong skincare product. For example, you have oily skin, then you go and use something ointment or creamy thing like balms or those very high tech sticky texture on your face. Eventually, you will mix together with your own sebum production, and they will create this blackhead, comedon's blackhead.
Oh, okay.
So imagine your pores is like a rubber band. There's a blackhead, tiny blackhead inside the rubber band. So day by day, you're putting more oil and more oil. This small tiny thing will slowly growing in size, and this rubber band will get expand in like maybe 30 days, 40 days. So one day you see like, hey, my blackhead that's very big. Let's go to find a beautician or a clinic to remove the blackhead, right? You will remove it, or sometimes you take out yourself at home.
Yeah.
After take out, imagine this rubber band, there's no more elasticity. They cannot shrink back. That's the time you have a big pores.
I see.
And that is the time that you need to find me to get this elasticity back to make the pore become smaller.
I see.
Yeah.
I see.
The most simple way that you can do at home is by using this ingredient I love the most is the Retinol.
That is another question I wanted to touch on because I started to use retinol also.
Yes.
I heard the best combination is, of course, face cleanser, then retinol, and then moisturizer to top it off. Retinol is like the most, if there's any product, retinol it seems like the most effective one to regenerate cells or whatever. Is that true?
Yes, correct. Because now it's a trend, and we found that retinol is one group of medication that can help you on your skin regen, like you say, and also it's a part of anti-aging.
I see.
Yeah, but you have to make it clear is there are main two groups. One is medication, and the retinol that I use is a cosmetic. There are two groups.
Oh, okay.
Yeah, the medication we call the retinoid cream or Tretinoin. There's a medication that you need to get from pharmacies. You cannot get over those skincare counter. You won't get the Tretinoin because this one need to be registered.
I see.
Because they are control medication. Yeah, they have their own side effect, and some people are not allowed to use. For example, like pregnant lady. Because it affects the babies and
because
so
it's
on.
quite strong, right? It makes your skin very dry.
Yes,
and stingy,
yes.
You know, and,
Correct. It's strong, and they have their own function. So retinol is something more calmer and more gentle to the skin. So can go for people who are moving towards maintenance. Yeah. So if you ask me to use a number to differentiate these two, I would say 6 times. Effectiveness.
6 times the Tretinoin
is 6 times
more stronger
than retinol.
I see.
Yeah. So depends on your situation. So if let's say your ongoing treatment, normally I start with the Tretinoin first. But slowly moving to maintenance, then maybe I will change you to retinol. Yeah, but this is a very good ingredient because they have proven that they stimulate collagen, they're anti-aging, they give you a fairer skin and more good texture. And this is also one of the exfoliator that you can use at home.
Oh, is that for exfoliator as well?
Yes.
Retinol is considered an exfoliator.
For me, it's an exfoliation agent because, like you say, after you use, you have peeling, right?
Yeah.
Why you have peeling? Actually, the peeling, they are helping you to peel off the dead skin. It's not the real skin, the dead skin layer. So after you use, you have a radiant, you glow. That's why a lot of ladies like it. Yeah, but of course, if you don't know how to use, you need to ask somebody have experience to guide you because everyone will react differently to retinol.
Is that a way to use it actually? Or just drop on it, right?
Yes, just drop. It's just that whether you have a very strong reaction towards the active ingredient. Yeah, because everyone here have different reaction one. Maybe for Jin that he will feel like okay, but maybe for you like peeling like really a lot, then redness. But you still can use? Yes, but we have some way to help you to adapt to it.
Oh, okay.
Yeah, but it's a very good ingredient.
I see. Actually, I did use before, but towards my skin, it's a bit like stingy.
Yeah.
Yeah, it's very stingy to my face.
That is normal.
Oh, okay.
So if those who don't know, they will think like, oh shit, this is something bad. I need to stop, right? Once you stop, you will never ever get the result from the tretinoin.
Oh, really? What
Yes.
if I use back again or it doesn't?
You're gonna start over again. You're gonna still get back the peeling. You're still gonna get back the sting sensation. You'll get the redness, and this process gonna last you for 4 to 6 weeks. If you can pass this 4 to 6 weeks, I can guarantee you're gonna see a very good result from this cream, and you will never want to stop.
Oh,
Yes, you tell yourself, oh, how come I last time I don't know, then now I know how is it work. They don't want to stop. I have clients been using 3-4 years. Yeah, and then they will come back and find me. Then they ask, hey, how come in a long time? No need, doctor. This simple thing can make my skin look good all the time, and I don't need even come and
the tretinoid.
Yeah,
Still at the tretinoid level.
yes,
Not going
not
into
even
the retinol.
No, they like the tretinoin.
Wow.
But I thought this is a medical grade. Have to seek.
Yeah, you need to
Medical.
seek medical advice to use, and you need to have someone to guide you. Yeah, when to stop. But is there anyone that you need to stop? Yes. For example, too much of information. Then we have a step up program, meaning starting from maybe 3 days once for 2 weeks. Then if you're improved, then we go 2 days once, then daily like that. Yeah, but there's for me, my center now, there will be the essential in terms of skincare. Essential.
I see.
Yeah.
Maybe you should try.
Probably.
I haven't gone through the tretinoid stage. I straight went into the retinol stage.
Yeah, because I look into social media, they just recommend the retinol.
Yeah,
So
retinol.
I'll just buy.
Because retinol easy to get
Easy
in
to
the
get.
market. So there are two concentration. I think it's 0.5%. There are some is 1%. Some custom one you can get even 2%. Yeah, I think 2 is a max already.
But when they talk about serum, right? You know, there's always the word serum you see in the shelf. Is that most of it contains retinol or is other things in it?
No, retinol can be in a cream form, in a moisturizer form, and also can be in the serum form.
I see.
Yeah. So depends on the brand.
So is serum needed actually? Like,
uh,
I see a lot of, you go to the pharmacy or what, they will ask you, I need to use this serum, you know, is that really
Okay.
does that really work?
I don't look at the step. I look at whether the ingredient, the active ingredient you need or not. Yeah. Let's say your moisturizer that do not contain any exfoliator agent, even your face wash doesn't contain any exfoliation agent or maybe toner, then maybe you really need something to exfoliate your skin. Then you maybe need a serum that contain retinol. Maybe if you don't have. But some people are too much. Too much meaning cleanser have, toner have, then they add on another serum with the retinol. So that time normally they'll give you problems. They'll burn. They normally will burn because too much. There are three steps of exfoliator. Why you need 3?
Toner is exfoliator, so?
Depends on the ingredient. Some have salicylic acid.
Yeah.
That was also exfoliator. They also make the skin peel. So I would say if you want to have ask me which is the best skincare, I would say you choose the active ingredient and you need only one. in any of the steps. Yeah, actually, it will work.
I separate nicely lah.
Yeah, but separate nicely. Yeah, it will work one. It's just that you need to have the mind that, okay, I don't need one of these, I need one of these. Or some people are too much moisturizing. I see what's it called? Toner also moisturizing, then another moisturizing cream, then serum also moisturizing. Do you really need 3 steps of moisturizing?
I see.
Yeah, actually no need. You only need one.
What's
Yeah.
the function of the toner actually exactly?
Actually, I want to ask this because you didn't mention about toner just now.
Okay, let's put aside the active ingredient in toner. Toner, the main function actually, we call it the second layer of cleansing. Meaning,
Oh, okay.
there are something that you cannot cleanse with your normal cleanser. Then you use a curtain to wipe with the
That's
toner.
why that is always the second step, right? Because they
Yes,
usually like
yes,
cleanse
yes.
your face first, then you
Then
use the
the
toner.
toner.
Yeah, the toner is a second layer of cleansing.
I
lah.
see.
And also, another function is sometimes they'll put some ingredient to make the skin pH more neutral, so that the next step, which means the moisturizer or the serum, is much more easier to absorb.
Oh, okay.
Yeah, but nowadays, they also put a lot of active ingredient in the toner. Some even have hydration. Then, like I said, the salicylic acid for the oily skin type. Which is it okay to use? Yes, of course. But don't repeat in the next step.
I see.
Yeah,
I see.
Yeah, I
So-
face a lot of problems like this.
So either you use one product that has all the active ingredient there, the salicylic acid or the to remove your dead skin and everything, exfoliator, or you do it step by step.
Yeah.
You separate the product, right?
Yeah.
So toner means just toner,
Yes.
and then you have the retinol or whatever
Yes.
exfoliator that you're using,
Yes.
and then maybe end up with a moisturizer,
Correct.
right?
Yeah. Do not mix everything together and repeatedly doing the same active
Because some people
ingredient.
thought like, oh, extra power, moisturizer here, moisturizer there, so
Exactly.
everything combined.
Because
my
I think
skin-
they don't know the ingredient itself,
Yeah.
so they just like overuse.
Yes. Yes.
Yeah, because you see all the product. I have dry skin. I see the toner had moisturizing effect. The serum has moisturizing effect. The moisturizer had moisturizing effect. Like, wow, combine these 3 power, my skin will be
Like, very moist, right?
Yeah, very moist.
When very moist, then problem comes. Acne will start. Then you have some even have fungal infection because too moist.
Oh,
Malaysia is already very hot, right? And also very humid.
I see.
So plus all this moisturizer will give you, it's going to have a negative effect. It's not going to bring you any benefit.
Interesting.
Yeah.
Then Dr. Chin, I want to talk about like myself, right? Like if my skin use like all this, does it cure my like my scar?
No.
So what should I do if like my condition right now?
Okay. To be honest, if you're treating scars, you're talking about those bumpy one,
Yeah.
the sunken one, there's no skincare can help.
Unfortunately.
Unfortunately. Unless this scar is new. Let's say, for
okay.
example, this dented scar just happened maybe 2 months and it's still red in color, and you want to use some product to make it raise, right? I would say Tretinoin cream is one of them. Yeah.
But it has to be within this 2 months only.
6 months.
6 months, okay.
Yeah. For my reference, if the scar is less than 6 months old, it's still considered new. The best one would be still in red in color. Red in color means they're still healing. They're still in the stage of wound healing. So when you put something to speed up the skin cycle, maybe it will help on your this scar treatment.
I see. I see.
But the latest Tretinoin, the 4th generation Tretinoin already just come in Malaysia in April. Okay. Last few weeks ago, I went to their launching. The 4th generation Tretinoin can treat the dental scar at the early stage is around 20%, 25%. Yeah, to improve 25%. Yeah. So because they promote the healing. So that's why they can.
Okay.
Other than that, sorry, I don't believe anyone can use cream to treat that kind of scars.
I see.
Besides aesthetic treatment.
I see.
So I have to damage my skin first, right? Or what is the process that I need to in order to heal?
Okay, yes, correct. Because now, like, this is very old, I'm sure, more than 10 years.
It's more than 10 years.
More than 10 years, right?
I believe it should be 20 years.
So when you have all this dental scar that is very old, the first step you need to do is damaging the skin. Okay, but of course, this damaging you need to be under control, not the overwhelming damage. If overwhelming damage will give you side effect like permanent scar, even worse than now, or sometimes even get darker. We call the post-inflammatory hyperpigmentation. Yeah, so that one will make the skin look dark, and sometimes it can be permanent. Although books say it will resolve in 6 months time, but I have seen some that is not resolving.
I see.
Yeah, so you need to do the damage in a control way. So that's why we have a lot of technique like laser. We have multiple type of laser. Yeah, all these are been tested, proven, safe to use, and therefore it's inside the market. Yeah, that's why we call it the medical device.
I see.
Yeah. So basically, if you want to treat scar, you need to damage the skin. If without damaging the skin, you cannot get any kind of sort of good result.
But how much can I heal? Like right now you are seeing my face.
Okay.
Right?
How much do you want? I always ask, how much do you want? I'm sure a lot of people will ask me
100%.
100%, right?
Let's say 100%. Let's say 100%.
Yeah. Unfortunately, this is impossible.
I see.
Yeah.
I see.
No matter how much laser or how much type of scar treatment that you went through, maybe you ran through another 5 years, right? More or less, you still see the shadow of the scar.
I see.
Yeah, I would say if you go through a very strong treatment for 4 to 6 sessions like that, maybe we are trying to aim 75%.
75, that's very good already.
Yeah,
That's
75 is considered very, very good.
Mm.
Yeah, but 75% is each of us, what we look is different. Maybe 75 for him is this.
Different.
75 for me is this.
Right.
So that's why sometimes it's very difficult to judge. Yeah. So I always like to use before and after photo. So I would say, okay, you're from here, I'm going to achieve something like this. But is it possible? Maybe. Because this individual that I show you the photo is not you.
Yep.
Yeah.
Because I'm a different person to that guy. Right?
Yes. And everyone, the healing
process is different.
And their self-regen also is different. Yeah. I have seen not Malaysian, their healing power is very good. Yeah, even 2 sessions you will see very drastic change in their scars. Yeah, but some not really. There's a lot of factors behind it also, of course. Age, and also I would say ethnic group is also one of them, like lifestyle also one of them.
Then probably genetic as well.
Genetic and also the type of the skin. Yeah. There are people, the skin are more prone to scars.
Oh, okay.
Yeah, easily to get scars. Even just a small tiny cuts, they will get scars. Yeah, also possible. And also there are people that easy to get pigment.
Yep.
Yeah.
You see some mosquito bite, then it get darker, right?
Yeah.
If I see that kind of skin, sometimes when we do scar treatment, we also have to be more careful because it might trigger the darkness.
I see.
Because now you're doing injury, right? So it might trigger the darkness. Yeah, so every individual is very unique, man. So all this is based on the doctor judgment when they examine your skin and look at your hand and your leg, see how your skin condition, then roughly they know what kind of treatment is more suitable for you, I would say.
I see. So it won't exactly heal 100%, but 75, maybe 60 to 75 is a good number, right?
Yep.
So that is the ideal rate lah. It won't have like perfection, I guess.
But if you come early stage, right, it'll be maybe at 80, 85. Yeah, if you come less than 6
probably
months.
when I was like very young at that time.
Yes. Then you will get a better result.
Is there such thing as too late? Like maybe if you're too old, gone past a certain age there, your skin is damaged and it's reversible anymore. There's no treatment you can do. Maybe from scars or pigmentation or black spots or even wrinkles.
No.
Is there? So there's never too late. Is that
Never
what
too
you're saying?
late.
Never too
It's
late.
just that the method that we use may be different in each group. Yeah, for example, let's say pigment. You have 30 years old and another one is 60 years old.
Yeah.
Maybe the 60 years old require more session compared to the 30 years
I
old.
see. I see.
Maybe. Because first of all, the 60 years old, the regen is low and the skin is thin. They cannot handle so much of the laser energy. So when I reduce the laser energy means the result won't be that great compared to the 30 years old. Yeah, and also preparation before the laser. whether you give some cream first to prepare the skin to in order to receive the laser treatment without any complications. Now, all this is have to plan. Yeah. So there's actually no gap. I have my client that's come in 70. They also want to have a good skin.
Wow.
Yeah. But sometimes I like older client. Why? Because you can see big changes.
That's true. That's true.
You can see big changes.
Yeah, definitely.
Yeah, that's true.
Because if you come in your early 30s and you say, oh, my skin is very bad, then you want to do something, you can't see a drastic change because you are in the early 30s. But you come in 60, I do simple thing, you will see, wow, yeah, there's a lot of changes. So,
I see.
But when should people start to look for you compared to they're doing skincare at home, but they come to a point where I think my skin is getting worse, I need to look. Where is that point where people feel that they should come and look for you?
okay, I would say,
Is it purely they want like a big drastic change, then they come and look for you? Whereas if they're doing it at home with their skincare routine, maybe it's just maintenance, not so obvious that they. I'm talking to people who are not like perfect skin, like they have
Okay.
a lot of pigmentation and everything.
my cutoff point would be like below 30, you just continue with your skincare.
I see.
Above 30, you can start some simple one, like simple aesthetic treatment. You don't need to be like too aggressive. Just a simple one, maybe like depends on the time what problem you are facing. Let's say early 30s normally not much of problem. You just want to maintain. Then you can go to do some sort of this gentle laser, like a
see.
bit gentle one, not so aggressive one, and no need to do monthly also. Maybe like 3 months once, 4 months once. Yeah, just to maintain the current good condition. Do some skin booster to boost up the skin, to reverse some of these sun aging and the sun damage, and also the lifestyle, all this to reduce kind of all the skin aging. Yeah, I think 30s will be the age to go with. When you come to 40s, then you have more things to do. Meaning you are talking about sagging when you're above 40. Below 40, I don't think you have any sagginess, to be honest. Unless you have certain condition, means like initially it was like 80 kg, now you're 40. Then maybe you have some sagginess.
I
Then
see.
you need to do something about it.
Pimples as well, like people people below 30 will definitely like in their maybe early mid-teens they have pimples. I guess that's also a factor that they can come and look for you, right? Issue.
Yes, my clinic, a lot of pimple case because I myself suffer pimple during teenage time. Right. I think when you know me, I'm 15 at the time, I'm full of acne.
I think so. And
Yeah.
now you have like great skin.
15, and thanks to my teacher in uni. Yeah, because the story is like this. When 15, I start to grow acne, and that time we don't have all this aesthetic. Then my mom also won't bring you go to see any skin doctor. All right, so they'll bring you to aunties to wash your face.
Yeah.
All right, and the auntie will give you some cleanser, toner,
Yep.
and some moisturizer to put. Not even medication cream, just all this skincare product. So my acne was continue to be worse until I think Form 6. Yeah, when I almost 19, and went to uni in Russia, and got worse. First year, second year. During second year time, when I went for a class, one of my teachers saw my face, and he asked me to stay back after the class. Yeah.
Okay.
Then she asked me to make an appointment with her after the class and go to her clinic. So she gave me some medication, some this pimple paste. Because Russia at the time is very poor, we don't have the good medicine like here, like those gel, like very easy to use. I'm using something like it's a zinc. So when I study right now, I know back, I understand why my teacher gave me zinc, because zinc have a very strong anti-inflammatory and also reduce the bacterial kind of property.
I see.
But it's a very not nice to use because it tastes like, the smell like mud, and it's black in color.
Okay.
So you cannot put, and then you go to school. Right. So that time that I have no choice. So he asked me to I go pharmacy buy it, and the pharmacy really make the zinc paste in front of me.
Oh wow, zinc normally we eat as a supplement sometimes.
Yes,
So this
correct.
one you're talking about putting on the skin.
Yeah, putting on the skin. It's a dark color, like really like mud, and smell like really like mud. So my pillowcase all the black color. Yeah. So after taking a medication, putting a zinc paste, acne resolved, left the scars. And the time she asked me, "Do you want to come into my study group?" Which means it's part of the
Research.
clinical research. Yeah.
I see.
That time using the carbon dioxide laser. I still remember she asked me to wait until winter. Then I said, "Oi, how come need to wait until winter?" Oh, then only I realized that laser will burn your skin
Oh.
to create the damage. And it's super red, and you see like, it really like burn. So
Yeah.
when in winter time, you feel good because outside is freaking cold. So it will ease the pain, and also it make the wound heal faster. Yeah.
I see.
So that's the time. Okay. I think I did twice or 3 times, but in a gap of 3 months, because it's very painful. The time don't have like those technology like nowadays. It's a still very old time laser machine.
I see.
Yeah.
I see.
Yeah. So therefore, that's why I'm trying to help those who are suffering acne now, to prevent them to have scars. Yeah. Because scar, like I say, it cannot be perfectly removed, right?
Yep.
So the best thing to do is you prevent it. You make sure there's no scars. You have marks, you have red marks, dark marks, but it's flat one. I can remove the mark 100%. No issue at all. But you give me a dented scar, then there will be a problems.
I see. Pimples are genetics, right?
Yes.
Or does it have any other factors as well? Because some
I
people
would say-
just have a lot of pimples compared to some people.
I would say genetic.
Genetics.
If you ask me, based on study, the kids whom father, mother have, either one have pimple, the kids will have 40% chance to get pimple in their teenage time.
Oh, really?
Yeah, either one of them, father, mother have acne issue, the kid with 40% have it.
Okay.
Yeah, because that's all depends on the oil gland number. Yeah, number of oil gland on the face. Some people are born with a lot of oil gland. Some people are born with just a little bit. Like my boy, I think he will have acne because
because you
baby
used to have
time
acne.
baby time already have already. He
Oh,
have
wow.
baby acne.
Okay.
Yeah, because of all these mom giving the breast milk, cholesterol, all these.
Yeah.
So he have acne on the nose. Yeah,
I
so
see.
I think my boy next time in future also, maybe, I don't know, maybe he will have
But
acne.
actually,
also.
mine also have like have a baby acne even during 1 month.
Small. Yeah.
1
You see,
month
because
have the baby acne.
because the oil gland a lot on your face when you're born, the first day you're born, you're already fixed. So I cannot change this. But now good news is we have a latest laser which can target the oil gland.
Oh, really? Wow.
Yeah, beside medication. Okay, because the medication, we have a very good medication to control the oil for many, many years already. But because of the side effect, and also now finally we have some laser that can particularly target the oil gland, make sure your oil gland produce less oil, so your acne won't have any more problems.
So this will be probably around like 16 or 17 or 18 years old will need to use this, or when should we?
Yes, when you have very active oil gland that time.
I see.
But also you need to think the financial part, because this laser is not cheap. As I know,
I'm sure.
per treatment is around 2,002
per
2002
treatment.
per
per treatment. You need at least 4 sessions.
I see.
And then you'll be acne free maybe for 2-3 years.
Wow, so need to do it like maintenance, a couple of years. Like,
4 is the clinical study. Means they do monthly for 4 times. Then this individual is acne free for 2 years. That is based on the study.
So every month, one time? Or?
Everyone one time for
okay.
4 months.
Okay.
Then after they can stop. Then the
Doing
oil gland
it.
will be totally reduce the sebum production.
For 3 years, 2 to 3 years.
2 to 3 years.
But still have to do maintenance, right?
I think so.
no, after
Okay.
2 to 3 years, then repeat the same process again?
Maybe.
Or there's a maintenance, like,
I have no
like
idea.
a cheaper alternative maintenance? No idea.
Now, the currently one, those who have active acne, after resolve everything, no more problems, the maintenance for me, the cheapest maintenance is tretinoin cream.
Ah, okay.
Tretinoin cream will be my best choice
So
now.
that is like the savior or the cheapest alternative that you can do,
Yes.
the most effective alternative that you can do.
Yes.
I see.
Yeah.
Interesting. So speaking of you as a esthetician doctor, probably you're more established, you have a clinic yourself. We often nowadays hear about like the self-practice, the unlicensed or unofficial one, like the
yeah.
back doors, in the
Yeah.
house, people go there and
Okay.
don't know what they've been given. And
Yeah.
some people get pretty good result even. That's
Yeah,
why
yeah.
they keep recommending people to go there.
Yes.
But
Yep.
what are they doing? I have no idea. So what are your thoughts on that? What do they actually do?
And will they actually disrupt your business?
That's a good question.
Yes, I would say yes. First of all, because of the regulation is not strong in Malaysia, I would say. Okay. And even though, let's say you report somebody that's not belong to a clinic or a medical center, you report to KKM, our health minister, they can't do anything. They'll say that they are not under their jurisdiction. They cannot take action. Yeah. So for example, like you see a beauty salon that they're doing some illegal things, right? And what can you do?
But is it safe? That's the question.
Okay, safe or not safe is definitely not safe. The most important is whether they can save you if some shit happen. That's my
see.
question.
Let's see.
Okay, so I take let's say I take an example. 2 years ago, this lady went to beautician to inject something. I don't know what is that. Okay. After the injection, third day, the whole face swollen
Damn.
like a chipmunk. Okay. So went back to the beautician. The beautician even give her antibiotic herself.
Oh,
Wow.
she
So she
prescribed her
can-
own antibiotic.
Yes.
And she's not a doctor, right?
Yes. And she giving IV.
Wow.
Yeah, giving IV medication. Then give her oral antibiotics. Okay. But it doesn't resolve after 2 days, 3 days, it's still very swollen. Okay. So this lady came to me because I think she asked, you go find a doctor to solve this problem. She came to me and I asked, what kind of things that you inject on your face? She said she don't know. Yeah. So I said, if you don't know what you inject, I also don't know how to help you. I only can give you some anti-inflammatory medication. Okay. Most probably you need to drain out the thing that you inject. But to drain out, I need to know whether there is liquid that can be drained or not. Maybe there's something that you can't drain. It's very sticky.
Yeah.
Stick to your skin, right? So I said, maybe you can call your beautician to at least honestly tell me what they inject. So when the lady sent a picture over, it's something right there, aqua, something like that, and no proper label, nothing, no
man.
brand,
No
and
ingredient.
no ingredient is something got Chinese word.
Oh,
Then when
man.
you touch, it's like a swimming pool. I
Oh
mean like
my
a water bed.
God.
Oh.
It's like spongy one, doing like that.
Oh.
So I asked, so what you want me to do? You want me to drain? But I don't know whether it can be drained or not because I don't even know what is the active ingredient inside this box. So she said, okay, maybe you give me some of these anti-inflammatory medications, anti-swelling first, and we observe. So I just passed this thing because she said, if you drain out already means no more, right? I said, yeah, drain out mean if drain out good mean no more, then it won't be swelling lah. But her concern is that means I waste my money.
Still care about
Oh
the
my
girl.
god.
So you see that's the I don't know. Maybe this is the public awareness is not strong, I would say. Yeah. So I always say whether they can save you when problems happen or not. Even me myself, I also cannot guarantee that you don't have problems. So that's why a professional, the main difference between professional and non-professional is professional will tell you what might happen, the risk that you're having. Okay, for example, when you're doing certain injection, there's a risk, or you maybe have bruises, you have bumps for a few days, then some even have allergy reaction. And if let's say this is your first time doing, because I don't know whether you have allergy or not because it's your first time, so we will tell you in beforehand, not like after I do, then the problem happen, then only I can say, oh, it's part of the possible outcome or possible complication. No, it's not like that.
And also because you're using all the steps and ingredients or medication that is being approved, tested and approved, right? And whereas you go to the back door and you don't even know what ingredient they're using.
Yes.
It could be some the homemade stuff that
Exactly.
they try and just inject it on you.
So that's why I always say, if you really want to go for that, okay, you can go ahead, but at least you know what ingredient that you inject into your face or into your under the skin, right? At least you know the ingredient.
Yeah.
At least the brand or maybe the box of the thing. So some clients say, oh, they don't show us the box. Then you're not worried about the inject, just like maybe pure water or just a normal saline, but they charge you 3,000-4,000 just for the water.
3,000-4,000. Oh my god.
Yeah. I mean, their charges is not cheap.
Even more expensive than your clinic. That's why you mentioned about like, okay, doing the sky like 2,000 plus.
Yeah, I would
one
say.
injection is like 3 to 4.
Yeah. Correct.
Oh my
Because
God.
I would say the difference, like I said, the whether they can save you, and another one will be they're there to promise you. Yeah. So for example, they're there to say, oh, after you do this, you're 100% you're going to have this.
100%.
100%. Right. So you won't hurt this from a medical doctor 100%. There are no such thing 100%.
No such thing as guarantee.
Even the medication is also, we approve if let's say 80% is effective. Imagine the vaccine, 80% show good result, approve.
Yeah.
20% no good, we still use, right? It's just that we are judging based on the risk and the benefit. Yeah. So sometimes I ask my client, you want to do this? Okay. Then the risk is this. Are you willing to take the risk or not? So if you're willing to take the risk, okay, let's do it.
So what happened to
I don't
the
know.
client?
She never come back already. I have no idea.
She never come back after
She
that.
never come back after that. Yeah. I'm not sure. Maybe resolved already. I'm not sure.
I hope she's okay.
Yeah, I hope she's fine. Yeah, maybe let the ingredient that because it's like water, they definitely will slowly absorb. Maybe take more days. I'm not sure.
I see.
Yeah.
Right.
Then Dr. Chin, like, is it in social media right now? Is it helping or harming us right now? I'm not talking about perception of beauty.
There's so many experts, self-proclaimed experts out there, right? Giving all sorts of tips.
Yes. I would say you need to be wise to choose which person that you follow or you listen. That's the only thing I would say. Because now with the AI, right, you never know who is the one behind that. And also, some even now with the AI can change the voice. You put my face, but change the content of the voice, right?
Yeah.
So I would say, just choose wisely lah. And sometimes I would say most of the time, especially advertisement is too good to be true. Too good to be true because we need to be more realistic a bit. Yeah. So of course, I also have received client asking me, is it possible from this to this? I say,
70% lah.
yes or no, but this is a bit too much, I would say, because it definitely for me look like a Photoshop.
I
Yeah.
see.
So for us, medical, we always use a standard device, like a proper setup like this, or maybe some scanning machine. So you cannot change that. Yeah, you cannot edit the thing. So that will be the real one. So even with this phone now, I don't think this photo is real because they have all this color
there's a
enhancer,
filter.
filter. So sometimes some clients send me the photo with the phone. I cannot tell them what's the problem because I say your photo is not clear and maybe it's already filtered or some maybe already enhanced. It look more worse than your real person. So you better come to me before I say anything to you.
I see.
Yeah.
To see the real person rather than just the photo, lah, right?
Yeah. So if you follow a good one, you'll get a lot of good, correct information, which I think a lot of doctors also are trying to do that because we still cannot cope with the others other than us because their advertisement, all these social media are more stronger and more, I think maybe 2 to 3 times more content than a medical doctor because sometimes doctor don't have time to do all this content.
Yep.
Correct. Or also we are regulated by KKM.
Yep. That you cannot really advertise, right?
Yes, exactly. So sometimes it's very difficult for us to tell you, for example, like a bit of like medical term that to say, oh, you cannot tell this because you are not a specialist or something like that. So it's very difficult for us to educate the public. Yeah. So that's why I say if we say whether we harm or not, it depends on who you follow. Yeah.
I see.
Yeah. I do follow a lot of good dermatologists in Malaysia and also in who doing content one. Not a lot, seriously, not a lot. I would say overseas are much more better compared to Malaysia.
I see.
Yeah. Reason is I would say because that particular country is very competitive and also they have regulation cannot promote themselves. So in order to let people know them, they only can do content to make themselves famous and well known so that people will go to that clinic.
I see.
Yeah, that's the way the like other country people, other country doctors are doing lah. So based on those good content and with the proper information, so I think the public is more well educated. I would say the information is more precise and more informative and correct one.
I see. Just to wrap things up, I just have two more questions. Speaking of just now, you mentioned too good to be true, Professor. Is expensive product, like skincare product, better than those you find on the normal shelf, the pharmacy shelf, like those branded skincare product which you pay hundreds of bucks?
Good question. Like I say, there's no best product or best brand in the market, but there will be always have the most suitable skincare product for your skin.
Right.
And also you need to go back whether that particular expensive product, the active ingredient, is it the one that you are looking at? Yeah. For me, I would say as in a business view, they are expensive because of number one should be
The branding.
the branding. Or maybe they are really good in research, R&D. They spend a lot of money in R&D. That's why you are paying that for the R&D. Yeah, there are certain products are very good in R&D. That's why it's expensive. But sometimes even the big company also have bad thing happen. Just like recently, the French brand, I'm sure a lot of people know the L and R. They're also calling back their one of these acne product, which the ingredient is too high in concentration, can cause cancer.
Oh, damn.
Yeah,
Okay.
multi-billion company also have that kind of mistake. So, is it because they are expensive, they are good? Maybe not. Yeah, it's just that whether the ingredient is it correct or not.
I see.
Yeah, so I would say this is very important. You need to do the brand study, the background. Yeah, the background, see whether this product. Okay, you want to know whether it's good or not. You need to know how long this product in the market. If this product stand long in the market, it will be good.
It'll definitely have its own credibility.
For me, it will be good. Yeah. So, for example, some brand is standing in the shelf for 20 years already, still using the same brand, more or less still using the same ingredient. You know that they are good
I see.
because it's effective. Then people will keep buying. Those are not good and not effective one. Normally they'll change. They'll move to another new packaging or new brand.
I see. I think people need to understand the ingredients also. Like what you mentioned makes sense. Every single brand if the ingredient works for you, is suitable for you, then it works. Not necessarily the price.
Exactly.
Right.
Yeah.
A lot of people just buy because of the brand and the price, but what's inside there, we actually don't understand. How is it going to help us? The active ingredients going to help us. Nobody actually cares to go and research, right?
Exactly. And sometimes even maybe bring harm to your skin.
Yeah. So let's wrap everything up in one package. All the things we have talked about just now. What is the best tip for anti-aging?
Conclusion: anti-aging, first step, sunblock.
Yep. That's all right. Sunblock.
Second will be healthy lifestyle. Yeah, exercise. Try to reduce your stress, and I think a good diet give a very big part of in terms of anti-aging. Okay, and the last one is I learned recently one, which is I learned from these dermatologists in Taiwan. So she got say something like, if you want to have a good looking and a good skin, right? Basically, your mind and your thought, you need to have the positive way of thinking first. So, for example, you have acne. Okay, there are a lot of people have worried one. Oh, I have acne, shit, or I have scars. Then this thing will going to trouble me for many years. It's not going to go away. Okay, doctor say like that. All right. So they have always in a very stressed condition. In that kind of individual, they will never get better eventually like in a very fast, in a short time. Then they will take a longer time because the mind is not there to ready to accept that, it's problem here, but I have a solution. And this solution going to bring me to good. Yeah. You cannot see the good time is coming. You only keep on thinking the current state. So these dermatologists tell me it reflect what you think.
I see.
Yeah. So which I think is true. I mean, you can look around. Maybe you can look at those successful businessmen and also the entrepreneur. You see their face is actually quite good. If you have chance to interview them, I can tell you, they also didn't do much in their skincare routine. I think so. Yeah. I mean, basic one, yes. But you're asking me whether they have do a lot of things. Maybe no. Maybe. So maybe all this come from internal because, it's a big part of it is about all the insight.
In the inner energy, the positive energy.
The internal and also the aging part is they reduce a lot of this intrinsic aging. Not the extrinsic. Extrinsic is all the pollution, the outside factor. But the intrinsic aging, they are actually quite maintained quite well.
I see.
And I think it matters a lot, right? Because it's inside your body. It's your body anyway.
Yeah. Because it's like I say, skin is the organ. So it will reflect how good your body is.
Yep.
Yeah.
I see.
So I think this is also very important.
I see.
In terms of the mindset.
And right work mindset.
Yeah.
And of course, to top it off, a good and simple skincare routine.
Okay.
Right.
Yeah.
Just now.
Yeah, that's a very basic one.
Yeah.
Which actually boys and girls also need it. Not only for girls. Men should take care of their skin too, I would say. Yeah. Because my client have a lot of men too. Yeah. I mean recently. Yeah. It's just that Malaysia now we don't reach certain stage that we are very hardcore, I would say. Hardcore meaning I realized this thing is because I have a client, maybe 15 years old, acne issue. The father is Malaysian, the mother is Vietnamese. Okay, but the father brought the son come and see me. Okay, and when I suggest all the treatment, the father do not want anything. They just want a cream. But the son, the son, the condition is quite bad. He require medication to prevent the scars. Okay, so because the son cannot say anything, so the father said, "Okay, I just want to purchase this cream. That's all. I come and see you next month." Okay. So when the moment she walked out the door, the mom arrived. The mom bring the guy in. The mom straight away say, what my son have to do here? I say nothing because your husband say only purchase the cream. Then the mommy say no. I want everything you say.
Oh wow.
Then I was surprised lah. How come you guys have two different type of opinion? Because he said, in Vietnam now, if a young boy like that with the scar face, he can't get a job.
Oh wow.
Oh really?
Really?
Wow.
He can't get an office job. He can't get even a waiter. He can't get with the acne like this.
Wow,
he can't
really?
get. I was like, huh? Really? He said, yeah. He said, you think I'm joking? You go Vietnam and see, working in restaurant, all their skin must be good, especially those a bit high class one. It must be good.
Oh really?
Even job interview also got right there whether you have acne scar or not. They have to write. So you see, we are not there yet, but other countries are already yet. So that's why the mom is so worried about his son. Said, of course she's joking also. I said, next time also cannot find girlfriend. So I would say like maybe Malaysia are moving towards that soon, maybe.
Yeah, I think it's definitely a very important thing. Like I say in the beginning, not just taking care of your health, which is important, or your skills and everything. I think the skin really reflects a lot about you, how disciplined you are, how much you care about your own body.
Especially the first impression.
The first impression, right?
Yeah.
Because people look at the face first,
exactly.
first thing, before look into your personality.
Yeah,
right?
exactly.
Yeah, so I think it's an extremely important thing that a lot of people overlook. Yeah. So thank you so much, Dr. Chin, for coming on the show.
Thank you, Dr.
Thank
Chin.
you so
definitely
much.
clarifies a lot of the myth and all those misconceptions that we have been hearing, and I think I'm going to improve my skincare routine based on your recommendation.
Okay,
Yeah.
no problem.
Dr. Chin, before we leave, where can people find you?
Yeah.
Okay, my clinic is located in Kota Damansara, just 2 doors beside CIMB Bank, Kota Damansara.
Okay.
The name is called True Clinic.
True Clinic.
Yeah.
Okay.
If you have any question, you can just drop me on WhatsApp or even you can go to our social media and ask us some question, or you want to know what kind of service that we are providing, then you can get more information from there.
Okay,
Yeah.
fantastic. We'll drop everything in the description below so you guys can check it out and check out what Dr. Chin Clinic, the services that they provide. But I hope you guys enjoy this episode. Don't forget to like, subscribe to the channel so we can bring you more amazing guests. But in the meantime, if you discover this journal, don't keep it to yourself, share it to the world. Me and Steven will see you guys back in the next episode. Peace.
Cheers.
Thank you.
Cheers.
Thank you,
Bye-bye.
Dr. Chin.
Thank you,
Thank you so much.
Thank you so much.